structures related to the cornea, lens, retina, and several accessories, several gadgets, and it is also used for 3D planning of the surgical method and also for teaching. So we are looking at those two parts, teaching and surgical training. An article is there in the Kerala Journal of Ophthalmology by myself and Dr. Anju Kuriakose, where we have discussed all that. And then there are also separate articles on specific objects which we have 3D printed, including a 3D print adapter for smartphone slit lamp photography. One of the main things which in Arvind Pondicherry they designed is the 3D printed eyeball for training purposes, which includes not just a diagnostic evaluation, a 3D printed eyeball with a retina printed inside, attached to a slit lamp for examining, for fundus photography, for laser practice, and so on, indirect ophthalmology practice. It is also used for surgical training as well. And in fact, there is also an indentable model for practicing indirect ophthalmoscopy. This is the indentable model. This is based on a material called TPU, which is flexible. Then, of course, there are commercially available 3D printed eyes. So this is the Bionico models, which you can actually buy and use. These models are available without 3D printing also. They can be injection molded also. That is the one which is available in India. But 3D printed can be customized. So that is one of the advantages of 3D printed model eyes. So this is why another alumni of Arvind Pondicherry, Dr. Prashant Girish, had made this one. I think Dr. Rajesh Vedachalam also is involved in this 3D printed surgical eye from Arvind Pondicherry. And this is from myself, 3D printed glaucoma drainage device, 3D printed CTR, CTS, and all these things are open source and available on this website. So this is thingiverse.com, where you can download and use these 3D printed designs. So these are the 3D printed models of, this is of an Orolab aqueous drainage implant. And these are some other models of 3D printed glaucoma drainage devices, and this is a CTR. All these were printed using a resin printer, and the source code is available on Thingiverse. This is another interesting design made with the help of two MBBS students in Ramchandra Medical College, who came to me for a project, and this is what we designed. We designed a punctal plug and 3D printed it using resin. And this is the 3D printed glaucoma drainage device, which we practiced implanting on an animal eye. So that will help in GDD surgery training. This video is available on YouTube if you scan this QR code. And of course, 3D printed teaching tools, you can even use it for practicing contact lens fitting. This is by Zhao et al. They used fluorescein dye to check the fitting of contact lens on various astigmatism and irregularly shaped corneas, which were 3D printed after designing on a free software called Tinkercad. This is by our chief instructor, Dr. PRASANNA Venkatesh and team. This is the 3D models which they have designed in CAD. And once these models were designed in CAD, they printed it and assembled it and spray painted it to look like this. So this is, I think they will bring this also. This is a 3D printed anatomical model. This is very useful in teaching. And these are the cerebral venous sinuses, again 3D printed. They also have the same 3D models in virtual space as well. You can experience that in the last presentation. There are also 3D printed models for orbit dissection. 3D printed orbit model can be especially useful, and all these are not very expensive. Once the design is available, you print it, the material cost is going to be 200 rupees or so, in that range of price. So don't think that 3D printing is an expensive thing. If you want to design it and you need to get the help of a designer, yes, but the actual material cost is going to be very less. So if you have an idea, you can build on
Dr. John, 1 minute. 1 minute left.
So 3D printed orbit model, you can also plan for radiation treatment by planning the pathways and all that. You can do it with even a software, and this one gives a physical model in your hand which helps us. And there's another interesting use by this particular group, Wu Choi et al., which they 3D printed the 3D model of the OCTs. So this is useful for explaining to the patient as well as for maybe surgical planning as well. So you have vitreomacular traction and a membrane and all that. You print it out, you get the 3D model, you can just show the patient this is what they have. And you can also plan for making instruments such as this. And myself, I use 3D printing to design an instrument called the foldable fundoscope, which is a fundus camera based on a smartphone. And also there is a 3D printed smartphone adapter which we have published in the Kerala Journal of Ophthalmology, 3D printed slit lamp microscope. These are not these are very simple devices which you can download and print. And this is another 3D printed innovation, transconjunctival trocar cannula system, which they designed, printed, and later they converted into a metal model. Even Canabrava's ring was designed in 3D printing first. And of course, you can use personalized 3D printing, and this is a 3D printed implant, and these are all the other things available. I thank all the institutes which have trained me. Thank you.
Thank you, John sir, for this wonderful talk on 3D printing. Now moving on to the next talk by Dr. Hirika Gosalia, Innovative Academic Filmmaking, How to Direct and Produce Ophthalmic Movies with Right Tools. Dr. Hirika Gosalia is a final year resident at Arvind High Hospital, Coimbatore. She has done two innovations during her early residentship and has published also on the same. Over to you, Dr. Hirika.
Yeah, hello. So today I'll be talking about today I will be talking about innovative academic filmmaking. So why is it important to make presentations or make videos or to make films? And because mainly it will explain the idea much better to the audience. It will convey the concept and make the audience or residents for teaching and for better understanding of any concept that you want to explain to the audience. Also, pictorial memory is said to be much larger than the textual memory. And if we had to make presentations or videos based on text, then why not just publish it or write it up? Why do you want to make it as a video? So it's important to make videos in a more pictorial manner, a more animated manner, to captivate the audience. So how the steps that I used and many others that I know have used to make the videos for which have won many academic awards. So first thing is a topic or the script. It's the most important part, wherein you have to build a script based on which your video will actually flow. It's some of the people that I know, they make their audio first, which has the script, and based on the audio they'll actually make the video. So the script is the main base for any video. Second is the existing softwares. As we all know, there's PowerPoint, then there's Keynote, and then there's iMovies. So whatever you're comfortable with, you can use any of the existing softwares. So mainly I'll be talking about this Keynote. The next important step here is templates or themes. So there are many free templates available online. Them even PowerPoint themes that are there on the software itself. So there's many Go slides and free presentation downloads and templates which you can use to get a theme for your video, and can give you a concept with which you can make the audience understand the topic better. So here you can see there's a war theme, then there's a comic style theme, and there's some spooky presentation, and it will just look very beautiful and different amongst the normal presentations, PowerPoints or videos, and can make the whole video look much better. The fourth step here is the fonts. So there are multiple fonts available online, again free download. Uh, why always use the normal Times Roman, Comic Sans, or Arial? You can use so many different fonts which are beautiful and very. They can completely change the way your presentations can look. There are multiple options online, and you can use any of them. It can be formal, it can be informal, it can be comic. There are multiple many of these options that I'm showing on the screen right now, which can be used for downloading free fonts on the existing softwares that you're using. So here you can see multiple fonts that I'm showing on the screen and how they just look completely different. You can apply them according to the concept of your video or theme that you have selected, or the template that you have selected. So here are a few options. Then talking about the fifth step, that is the images or the clip arts or the icons, which you can use to show a story in the video. You can use any image, you can download it online. You can use GIFs, which can like captivate the audience, and you can show some complication or management. Then you can use clip art. So here I'm showing how a clip art. So mainly you use a clip art with a plain background, and then you can use the one second, sorry. So you can use a background, a plain background, and then you can use the Insta Alpha option to remove the background, the plain background, and just use the icon, and you can crop it accordingly the way you want it in your video. So one second, why is it not playing? 1 minute. Okay. So the next is the sixth one, that is the music or the audio. So you can use any music, free music online, or any audio which can be used from YouTube, and you have to make sure that the music that you use is not free from copyright, which can like prevent you to fall from trouble. Then the seventh step is the animations or the effects. So there are multiple animation options available on PowerPoint and Keynote. So you have appear, fade. You can use any of those according to however you want, and you can build the animations and you can make it into series, and accordingly you can apply it on the images or the text box however you want it. Then coming to animations, we can apply these animations. You can see here how we can apply it over the image. One second. Not. Yeah. So here you can see how the image, you can select it, and then you can apply an animation, and then it will accordingly show the animation effect. You can select images, you can select text box, you can select any you can the title, or however the animations you want. So you're using move out, and then you can use fade, appear, disappear, or many other such effects or animations. Then coming to the eighth step, that is transition. So mainly transition is used to flow from one slide to the other, and it's used between two slides. So here there's a short video where we can see you can see how we can use a zoom or revolve, or there in PowerPoint we have the morph, or you can use a magic move in Keynote. So I'll show you a video showing the same. One second. Why is it not? So mainly what you do is you select a text box, and you can select the desired position where you want your text box to move on the screen, and you can apply magic move to make the object or the text box move from one slide to the other. Next, coming to the editing shapes. So in this, mainly you can take, you want to build a design on the slide. So you can select any shape, and let's say we are using a triangle here, and one second. Okay, then we can use movie editing apps like Camtasia, Apple iMovies, or Luna Fusion to edit the videos. iMovies is what we use normally. So there's an example here of a case report when we've just taken small text and applied it to icon, and we're just explaining a case with short text and not making it look very boring, and we're using like a 58-year-old male with the complaints and the nil systemic, and then you can just show the right eye findings and the left eye findings with just a very simple icon and a small few text. And here we can show the retina findings by using the zoom option over the pathology, and then you can label those pathology with the use of shapes and arrows. Uh, then you can also show the OCT findings with the use of shapes, and you can just point out over the available, like you can use a dotted line to show one layer of the OCT, and you can shade the defect over the OCT. And the next, so mainly showing your case rather than the usual conventional way of just writing text can make the audience actually look at it, and they will actually remember, and the pictures will actually be very helpful to understand what you're trying to explain to the audience. So thank you.
Thank you, Dr. Hirika, for that excellent presentation. Next, as we are waiting for the next Dr. Prasanna Venkatesh to reach here from the other hall, we will play a video on his topic that is about the metaverse and virtual objects that he has created for surgical training, and also for smartphone apps he has created. So this virtual reality and metaverse is a new thing that has become a household name with Facebook, which is now Meta, trying to put everyone into this metaverse. And this is an extension of virtual reality. It is a virtual space in which you have 3D objects, virtual objects, virtual meeting spaces, and all the workplaces, and even doctor interactions. All these are slowly getting into this virtual space. So Dr. Anugraha will play the video right now.
How we create
It's not.
Extension. Pull it to that screen.
How do I do that? It's here.
how we created a four-dimensional holographic diagnostic tool in ophthalmology, an augmented reality metaverse with patients' own real-time images. No financial disclosure. We have used Microsoft HoloLens 2 to create a world of 4D ophthalmic metaverse. For patient diagnostics. Our mission was to enhance diagnostics in 4 dimensions using our own patients' real-time, high-resolution ophthalmic scan images for better outcomes. In diagnostics, we predominantly use 2D images which may have many limitations in data representation. Currently, 3D diagnostic systems are slowly becoming available, but 4D diagnostic systems have never been reported in the literature before. Why did we innovate a 4D diagnostic system? Obviously, to address a problem. For example, the fundus and OCT are limiting in image representation in 2D. Our solution software, IMG, brings the images to life in 4D where all dimensions of the eye from all the slices can be accessed. In this video, one can see how the fundus and OCT are superimposed one over the other for precise diagnostics, and moreover they are available as holograms. The ophthalmic scan images are converted into holograms with a novel code developed by us, which is our intellectual property. Due to the lack of a comprehensive 4D diagnostic tool in ophthalmology, when the three-dimensional eyeball is represented on a 2D plane, there are chances of data representative blind spots. Hence, we have innovated the software IMG to enhance the 2D scan images by projecting them onto a 4-dimensional environment. However, it is important to note that IMG is a translational software and not an imaging tool. Not only the posterior segment images can be translated, even the anterior segment images can also be translated into 4D, such as corneal topography, specular microscopy, ultrasound biomicroscopy, anterior segment OCT, and the Scheimpflug imaging system. In this video, on the right hand side, the doctor seems to be moving in an empty space, but in reality, he is wearing an augmented reality headset through which he can see and access all the patient's 4D case sheets by touch, as shown on the left side video. Now, the doctor uses the hand tracker system to enlarge the 4D eyeball case sheet to evaluate the anterior segment and rotates it with his hands to see the ora serrata. The angles of the anterior chamber can be visualized both in gonioscopic view and electron microscopic view. Now, the doctor is customizing the zoom and rotation to view the posterior segment structures of the eyeball. Let us see the IMG software workflow. For example, when a diabetic patient walks in and when we do the fundus photograph and the OCT for him, his 2D data enters the hospital database, which is intercepted by our 4-dimensional translational software IMG and is converted into 4-dimensional holograms in less than 60 seconds instantaneously with minimal chair time. Now, in the fundus holograms, you will have the OCT slices embedded into it. The doctor can choose different slices of the OCT images to make the diagnosis of diabetic macular edema as seen in this patient. Before treatment, the patients can be counseled with their own holograms for making them understand the disease process better. After treating the patient with pan-retinal photocoagulation and anti-VEGF injections, the patient's 4D case sheets can be generated and the resolving macular edema can be shown in various holographic slices at the holographic counseling stations established for the patients. Not only for posterior segment gadgets, this translational software is applicable for anterior segment gadgets as well. Let us see few examples. The healing cascade of striate keratopathy from postoperative day 1 to 1 month. In these patients, the holograms can be zoomed to focus on the cornea, where all the different visits from first to last can be seen in the ASOCT template. 4D Scheimpflug imaging template can also be made use of to study the repair process of the various layers of the cornea and how the iris fumes suggestive of iritis also reduced from the postoperative day 1 to 1 month. In a Christmas tree cataract, 4D holographic phakic lens can be viewed to plan the intraoperative phakodynamic parameters. Doctors can also choose the ultrasound biomicroscopy template whenever needed for anterior segment pathologies. A good slit lamp photograph is mandatory for generating anterior segment holographic structures. Why we are unique is that there are no 4-dimensional diagnostic innovations till date where real scan images are used. We are the first to invent it. Our model is a subscription model which is also available on other platforms apart from HoloLens 2, such as iOS, Android, and the Windows. To summarize, our invention is a cutting-edge, patent-protected 4D technology for diagnostics with precision translational software for tailoring therapy. The team that innovated it comprises of an experienced group of eye doctors and 4D generalists. There is no difference in the reimbursement codes and there are no constraints in the regulatory path. Our aim is to aid 4D ophthalmic diagnostics, assist in low vision rehabilitation, for example, retinitis pigmentosa as senior, create a medium for 4D telemedicine and assist in 4D artificial intelligence, aid in diagnosing retinal pathologies with 4D multimodal imaging examination, along with additive use in the field of neuroanatomy pedagogy and microsurgical simulation module creation. Holograms are no more science fiction. It is a science-based reality. We have innovated and incorporated it into ophthalmology practice in real time. With time, our software will advance from 4D diagnostics to 4D clinical OPD and surgical procedures. Thank you.
So that was a video about the metaverse, and Dr. Prasanna Venkatesh is going to demonstrate the metaverse. You can sit back and watch the virtual metaverse come up in front of you. So that is Dr. Prasanna Venkatesh on stage. Over to you, Dr. Prasanna.
Connect.
Okay, so as we are connecting the laptop, I'll just tell you what the metaverse really is. So this is going to be a Microsoft HoloLens headset, and Dr. Prasanna Venkatesh and team have created virtual eyes with all the parts, including the fundus, the angles, and also all the parts, the cornea, lens, and everything. And you can actually put on this headset and see these virtual images in front of you and use your hands to interact with this. You can have a virtual instrument in your hand. Suppose you want to do a MIGS procedure, you can get a virtual eye stent inject in your hand and see this angle in front of you, put this instrument into the angle, inject the device. So this is what virtual training is going to be. This is going to be the future of pedagogy. You will be teaching all surgeons all these procedures they can imagine by downloading this into their virtual reality headset, like you have seen in the Matrix. You would have seen in the original Matrix, Neo goes to Morpheus and he starts the training. He puts him into the virtual metaverse, and then he learns kung fu in the virtual metaverse. So this is how surgery training may be in the future. Before they actually start surgeries, you would learn by downloading this data into your brain through this headset. So that is Dr. Anugraha wearing the headset right now. Camera pan.
Can we have the screen?
Yeah, so that is the headset, the virtual reality. That's the augmented reality headset. A correction, please. So virtual reality is completely virtual. Augmented reality is you see the world around you, and into that you get this projection. So
can we have the
screen from podium 2 onto the main screen, please? Can we have the screen projection from?
It's on the TV, but it's not on the podium yet. Yeah.
Yes, it's coming.
Aji, you can come here. So you can see here, this is Dr. Anugraha here. She's wearing the HoloLens, as John sir was pointing out. So this is going to be helpful for us in three-dimensional learning, be it the pedagogy or be it surgical simulations or you want to load? Aji, you can take over from her. Yeah. So this augmented reality concept, how it came into the field was, it had a fixture of extended reality, it had a fixture of mixed reality, it is more like a fulcrum of 2-3 concepts in between. We never get to dissect structures like cavernous sinus, circle of Willis, even the eye for that matter. If we don't have a good eye or if we have a bad eye when we are enucleating, that's when we really get to dissect these structures. So can we create a real environment which is helpful for us in creating a simulation? So this is something that we have worked on, and with good net connectivity is needed. We are trying our best to demonstrate it. So we have brought in these structures so that you can refine your hand-eye coordination skills as well. So not only you can see the structures in a third dimension, but you can also refine your skills in a third dimension. You want me to go for my presentation? Yeah. So we are trying our best to load it, and once we show it here, we'll also make sure the holograms are coming to your place at your doorstep. Yeah. So this is a surgical simulator that we have made. First, we'll be demonstrating this MAGS simulator. So this is an angle surgery simulator. Many of us would want to learn MAGS. First, show your hands to me in the coding metaverse. Yeah. You can see him. This is him moving his hands. So the hands, actually, you can see they are coded. This is real time, my dear friends. You can see him moving his hands, and you can see how the hands are being coded. So now catch the injector. Yeah. So my friend is going and catching the G1 injector here. So he's going to catch the G1 injector. Yes. So once the G1 injector is caught, so with this G1 injector, he'll take it into the angle and then start placing the eye stent into the angle. Yeah, just loading 1 second. So this is like in third dimension where you will be able to refine your skills. You can practice multiple levels, a simple SACS surgery or phaco. Those are again other simulators that we are working on. So you want to load? Yeah. You can show the injection of how you are placing in the simulator if it's possible. Yeah. So owing to the weakness of internet, I think you can take to them one by one, and you can also show them in person. You want to show the models that you have kept? Yeah. Yeah. So I'll just go to my presentation proper, and Aji will be coming down. He'll be showing you this HoloLens. You can examine it there because we need good internet connectivity to really show what it is. But I hope you'll be able to see the four-dimensional tool in your particular doorstep. Aji, make sure you show everyone. Yeah.
Does anybody in the audience have any questions about virtual reality, metaverse, 3D printing?
Yeah.
So as you were seeing, that was the metaverse which has all these virtual objects. In the first talk, we saw the 3D printing, that is the 3D objects in the physical world. So you design something using computer aided design, and then you can print it into physical objects in the physical world, which can be utilized for as a prototype or as a final device.
Okay, now few questions to the speakers here on stage. Coming to John sir, like how did you really think how to invent all these things? What was that struck you, and what was the time you spent, and how much did you invest, and what all were the sacrifices you made while inventing all these things?
Okay, so 3D printing, I made a few devices using 3D printing. One is the foldable fundoscope. So that was to fix an unmet need. So there was a need for a fundus camera for all the postgraduate students, residents, and fellows to take fundus photographs of the interesting things that they see. And you cannot use a commercial fundus camera because it is very expensive, firstly, and also it is very big. You need something which is portable. Yeah. So that is why I had the idea, let's make something. There were already some devices, one which Dr. Biju Raju and myself, we had designed do-it-yourself fundus camera. 2016 we had published in IGO. But even though that was available, people were not doing it themselves. So then there were commercially available smartphone fundus cameras. Okay, over to you, Dr. Prasanna.
Yeah, sorry for the technical glitches, but I think we are back. So this idea was inspired from Hollywood movies that we all watch, right? Be it there is some issue with the connector, I believe. It's coming for you on screen. Yeah, you proceed, sir. I'll just try to sort this out.
Okay, so I had the idea that we should have something which is portable, but the ones which we first made the open source thing that you can make it yourself, people were too lazy to do it themselves. Okay, so nobody was making it. So then we had things which were commercially made, which you could buy, but people, even if they bought it, which they did reluctantly because they thought about the cost, they were not using it much because it was little too big to carry in your pocket. You had to have a briefcase to carry it. And to reduce the cost, there was also the trash to treasure red cam. Dr. Prithvi Chandraka had designed that, but again, it is a little too big to carry around. People were basically lazy to make it, lazy to carry it. So to overcome this laziness component, this was made, which is foldable and commercially available. You can fold it, put it in your pocket. You don't have to carry an extra briefcase. You just put in your pocket and move around, and you just open it up, put your smartphone and take photos. This idea of folding, that actually there was a lot of ideas which generated like that. That is, my son was closing the laptop, and we saw that okay, their table could be folded. All these folding objects gave us the idea that once you have something folded, it becomes compact. So that is how part of the idea came about. And then I basically learned 3D designing from YouTube. Looked up YouTube videos and downloaded the free software, FreeCAD.
Aji,
Tried designing,
Aji, can you
tried
give me your
designing
laptop?
3D models, and then because we had access to a 3D printer in Aravind Eye Hospital, Pondicherry, we had some basic idea of what 3D printing is and what its potential was. And that is how I started this. And at that time, I had joined Ramchandra Medical College, where also there were 3D printers of both FDM type as well as the resin type. And that was in the dental department, and they were waiting for somebody to utilize the printers. So with the availability of the 3D printers and free time during COVID, so that was a combination of factors which helped to create this foldable device. In fact, because of COVID, that extra free time created, that is probably one of the most important factors. Over to you, Dr. Prasanna.
Yeah. Extremely sorry once again for the technical glitches. So I hope this 4 minutes I'll be able to convey the basic concepts that we are actually doing. So you can see actually in this video what we are trying to bring in is, so I hope Aji will also be able to come and show you this innovation in real time. So this is the metaverse that we got inspired from Robert Downey Jr. from the movie Iron Man. So you can see him here that these kind of things that was once thought to be a science fiction, my dear friends, can these things made a science-based reality? So can we create a case sheet like this? As you can see, this is a patient with normal tension glaucoma. So where you can see that there is an NTG damage, where there is RNFL defects. So you can, if somebody sees him on the outset, it seems as if it's insane. But actually, he is one that is actually examining the patient's fundus, patient's anterior chamber angle in real time. So these are some things that we have coded in the metaverse. And if you see there is headset, okay, if I don't have a headset, what can I really do about it? So we are trying to actually bring in the smartphone as well. So this is a patent protected technology of ours, where we are trying to bring in the smartphone and also show these augmented reality innovations in the smartphone. So you just with a simple move of subtractive learning. So the subtractive learning is something that we have brought in. So you can see actually in this model here on the graph, if you can choose how you want to subtract structures. So not only we went ahead and created augmented reality, we also wanted to create a module of subtraction. So if you want to remove skin, if you want to remove skull, so this all this with the technology of LiDAR in your smartphone, you can subtract structures so that in textbooks, if you see a particular image, you may not be able to remove the images that you want to. But in this app, you can subtract structures that the way you really want it to be subtracted, and you can see the different anatomical modules. And this is like 3D subtractive learning. You can do the dissection in your own real hands, and you can remove structures. You can have no cognitive blind spot at all. It's a tactile virtual dissection tool, and it works on augmented reality. So you can see here on the right hand side also, just by loading your scan or your camera, you can see how the 3D models are there on the table, and all these structures are in your smartphone. You just need to have an iPhone today, and we have made sure we did the tougher job by cracking the technology, and you can have the hologram floating there. Either you can have a metaverse headset that will be circulating it for the benefit of the audiences here, or you can have a simple iPhone here where you can actually go through these kind of structures for novelty of examination. And not only that, you can have your own patient's EMR in this, you can have your own teaching module, your surgical simulation module, and whatnot. Any real images that you get, and you can also use filters like your anterior segment OCT filters, your diabetic retinopathy OCT images, or even your anterior segment OCT images. Every filters can be added in this, and that will give you an extra immersive feel. So the template creation was the main thing that we really wanted to do, and you can see that this is how we went ahead and created the template. And now if there is any pathological module, we'll just superimpose onto it. In 60 seconds the holograms will be ready for you to visualize and for you to see. And different fundus images, different examination sections, they are all available for us to really use it. And actually you can have your own database collection and just fit the image in your smartphone, scan it, and whatnot. So this, my dear friends, even for anterior segment gonioscopic images, we have used as real images as possible. And this is also having the filters of uh, the holograms in red free filter as well as in your multicolored fundus examinations. So as I was telling you about the OCT filters, you can see that in this you can also extrapolate the OCT images out from the fundus, which is giving you a next level of examination, that is multimodal examination. It can be pulled out, the edematous images can be oriented after treatment. Then what happens? So again the edema settles down, so how the macular edema is resolved. So all this can actually be seen along with the anterior segment images. So with this, we have published this in the Indian Journal of Ophthalmology and the European Journal. As you can see here, we call it the metaverse. And if the automobile engineer or a computer science engineer is able to dissect and learn, why can't we? Can the undissectable structures be dissected and learn? Yes, it can. And this is my team. And this is the metaverse that we have made. And apologies for the technical glitches. And we have 7 more minutes for the end of this session. And any questions, any discussion, any comments from anybody? Yeah. Meanwhile, I will just want to add on to Dr. Anugraha's comment. Hirika, how much of time as a resident did you spend in innovations? How much money did you invest in innovations, or was it eating up into your clinics and surgical things? How was it for you?
So mainly, sir, innovations actually, it was me as a first year resident. It was my curiosity that led me to two of my very early innovations, which was a very basic innovation about just a target fixator or a lid eversion.
8:55.
And mainly it came out of the need of why there is nothing really done about it. So I guess when you are a curious child in first year, you just want to know things and question things as an observer sitting next to your mentor, and that's when you come up with ideas. Coming to your question, talking about money involved, no, I didn't really. It was more of a do it yourself, cost effective, very affordable, anybody can do it anywhere. and that has opened doors to a lot of platforms for me. So yes, I guess it was mainly being questioning yourself every moment to understand what can be done better to the existing system, I think. Thank you.
Yeah, for me, what happened in the metaverse is we started with animations. When we made a lot of animations, we were not really making real images. So we wanted to make real images instead of animations. That's when we started digressing into this point of care innovations where the three-dimensional technology was being used. So we had to balance time between surgicals and clinicals. But again, the money invested in patenting was a real task, and that was quite biting. So I think can we have the connection here? We'll just want to show a QR code for the benefit of the audiences here. And the next session attendees, don't worry, we'll be handing it over time to you. And AI and AR is something that is really upcoming, and it is very, very promising in the way that things are. When we make a presentation in 2D, slowly animations started to find their role in, and now a three-dimensional medium of depicting a presentation is the way forward, where we'll be able to have structures in 3D in conveying the concepts better. What if we are able to communicate? Yeah, this screen, can it be showed there? The screen there. Yeah. So anyway, we'll have an informal discussion also below, and with that, we would like to hand over the session to the next group of participants. Any closing comments from Hirika or Anugraha? Yeah. Thank you, dear all, for this wonderful opportunity and for attending this session and making our day. So we'll give the QR codes to you, and at your free time, do visit the QR sessions. You can have the teaching content, and hope you had a good time in going through this wonderful metaverse that we have invented. Thank you.
Thank you, Dr. Prasanna, and all the IC speakers in the session. Thank you for
Thank you.
sticking to your time perfectly.
Thank you.